Hello, everyone, and thank you all for joining us today for a new session of the Gussie Campbell Collaboration Webinar Series. The Gussie Webinar Series serves as a platform for the Gussie Network members to share experience and expertise in evidence synthesis and to learn about potential collaboration. My name is Zahra Saad. I'm the coordinator of the Gussie Secretariat, and I will be moderating this session today. So before we begin, and if you are using the GoToWebinar for the first time, as you might have noticed, you are automatically muted. So if you would like to submit any comment or ask any question, please use the tab on the right in the chat box. And if you would like to address our presenter directly, please use the raise your hand button and we can unmute you for verbal questions or comments. So today's session is about enhancing the implementation of evidence in policy and practice, implementation science 3.0, the third decade. And our presenter today is Robyn Milden. Dr. Robyn is an internationally recognized figure in the field of implementation science and knowledge translation and program and policy evaluations in health and human services. She is the founding executive director of the Center for Evidence and Implementation, CEI, and the chair of the upcoming Evidence and Implementation Summit 2021. She's an adjunct associate professor at Monash University, visiting associate professor at the Yong Lu Lin School of Medicine, National University of Singapore, and founding co-director of the recently established Behavioral and Implementation Science Institute, National University of Singapore, and the co-chair of the Knowledge Translation and Implementation Group with the Campbell Collaboration. CEI is a not-for-profit global intermediary organization with offices in Australia, Singapore, and the United Kingdom, and partnerships around the world. Since establishing CEI in January 2016, Robyn has overseen the rapid growth of the center, attracting projects that range from those which aim to make sense of the evidence via evidence synthesis and reviews, to those that focus on the application of implementation science in practice and policy settings, to projects that focus on the use of rigorous methods to trial, test, and evaluate policies, practices, and programs in real-world settings. Robyn is a co-author of a recently released edited book, Implementation Science 3.0. Thank you for joining us, Robyn, and thank you for making this webinar.
Thanks, Sarah. That's terrific. I'm just going to make sure everybody can see my screen properly. Terrific. Zara, you'll tell me if people can't hear me properly, I'm assuming, by bossing me around.
Yes, of course.
Yeah, good. Well, welcome, folks, and thanks for joining from wherever you are in the world. I am joining you from Melbourne, Australia, so down the bottom of the very big island that we live on. It's early evening here, which is terrific. And for a lot of you, I'm guessing it's going to be morning into midday. I have to admit, I haven't given a talk since COVID without a camera on. So this is quite delightful, if not even stranger now that I'm used to having a camera on. So now I literally am going to talk to my slides. I'm going to talk for about, I don't know, 25, 30 minutes, hopefully make it interesting, because these things can be tricky to be entertaining. Feel free to ask questions in the chat box as you go, and you can come back to me later. So Zara's already done a nice intro for me. Thank you very much. And I'll get into it. So just a little bit about the Center for Evidence and Implementation. We have three main areas of work that we do. We're all about changing the lives for better by using better evidence, helping for that to be implemented effectively, and conducting evaluation in a rigorous way that answers problems that other people face, but also enables us to bring the best methods we can to answer the questions that people have. So We're what is sometimes known in other countries as an intermediary agency. So we sit between research, policy, practice, and philanthropy. Have a nice multidisciplinary team across a few countries now, and do a variety of work, all with that mission in mind. I have to, for this presentation, I have to acknowledge the co-editors of this book that we recently published. I would not recommend to anybody to do a book. It took a long time and it was a lot of work, but credit to Bianca and Aaron, so Professor Aaron Schlonsky at Monash University, and soon to be, hopefully, Dr. Bianca Albers, who's joining CEI again later this year. They were the two key editors for this, and I had a privilege of working with them on it. So a lot of what I'm drawing on for this presentation is coming from one of the chapters in that book. What I do want to talk about just quickly is implementation science has really undergone some pretty impressive developments in the last couple of decades. A lot of concepts people have come up with. There's a lot of models. There's been a lot of emerging evidence about what it is to achieve high quality implementation. And what I mean by that is an evidence-based program, practice, policy, or innovation goes from being a new idea to business as usual. The research around how to achieve that, or what determines that, has really exploded. So what that does come, though, when an area is growing as quick as implementation science has around the world, it does suffer from a few major gaps. So I'm not only going to try and talk about the things that we know, but I'm going to talk about the things that implementation science is yet to understand better, all in the honor of contributing to better outcomes for people. So just quickly, a bit of a definitional point. The evidence-based practice movement, as a lot of you would probably know on this call, emerged from the evidence-based medicine movement, in particular Sackett and the early publications that they did. Since then, there has been a sort of a modernization of the understanding of what evidence-based practice or evidence-based programs or evidence-based decision-making means. And it has led to people now discussing or talking about the use of evidence as evidence-informed. So from here on in, I am talking about this model of evidence-informed decision-making, in that evidence-based practice essentially is high-quality decision-making, so that middle part to the diagram, informed by a couple of things. One is good research evidence, and that's where places like Campbell really come into play, and Cochrane and the other kind of high quality systematic review clearinghouses. But not just research evidence, the state and circumstances of clients or people that we serve, and preferences and actions that are important to them. Those three areas sort of collide and need to be taken into account when making decisions about what the best approach is, what the best model is, what the best intervention is, what the best policy is. And that all sits in the context of the community in which the interventions or programs will be delivered. If it's within an organizational setting, resources and constraints, if there's particular training and supervision practices or a mandate, and that itself sits in a context that is driven by economic context, political context, and a historical context. So I think gone are the days where people sort of do a traditional pipeline. I'm going to comment on that in a second, and think about how understanding how good quality research evidence can help inform our decision making, but acknowledging that that's also affected by a number of different things. So given we're in COVID, I thought this slide would be interesting, because I certainly, in Melbourne, we have a very tough lockdown, and I feel like doing that every day at the moment, not like leaping over the not falling. But implementation science really grew out of the concern of this gap between high quality research evidence that's showing how we can improve the lives of people, and getting that implemented in business as usual. And some of you would have heard quite a common statistic that is shared, or piece of data, really, it's not statistic, and that is it takes on average around 15 to 17 years for something that has been shown to improve the lives of people to become business as usual in the services, systems, and policies where they could access it. So if you think about it, say, from an early childhood perspective, where we understand a lot of things that work in terms of helping build a child's brain and helping them develop up sort of healthy and well and mentally well, that's 3 generations of children that would miss out on things we know now could benefit from them because of the time it takes for us to go from innovation to effective implementation. So that is essentially where implementation science emerged from. And by definition, this is a famous definition a lot of us use, which is where implementation science is the scientific study of methods to promote the uptake of research findings and other evidence-based practices into routine practice and therefore improve the quality and effectiveness of services. This quote here, the 2 authors do work mainly in health, so they're referencing health services, but you could put that in education, human services, international development. So if you think about implementation science as the bridge between research and implementing something where it becomes beneficial to all. This graph here is just demonstrating for a second, we wrote a little bit about this in the book, that the increase of publications globally that use the term evidence-based implementation or evidence-based and implementation. So one of our co-authors did a systematic search of the literature, and you'll see the steep climb of publications mentioning the implementation and mentioning evidence-based and implementation, pretty much from about 2000 up to where we are now. So we think about that as the first decade of implementation science, but I'll talk through the contribution that was made through that. So there's a couple of key concepts in implementation that the first decade of research really helped us understand. And sorry, this is a little blurry, but you will be able to get a cleaner version at the link below. One of the things that early implementation scientists did was observe the process of implementation and study what seemed to be common in terms of what phases people go through and what actions or behaviors that they do. And as a result, they write these frameworks up and publish them. And there are over 80 implementation frameworks in the published literature. And a lot of you, or some of you may have heard me mention a few times before, I don't think we need any more implementation frameworks. I think we have enough. The one I'm sharing with you here is called the Quality Implementation Framework. It was developed by a young researcher who essentially looked at all of the implementation frameworks that had been published to date, probably up to about 2015, and synthesized them. So looked at what were common in the phases and what were common in the activities. And so you can see here there's a phase 1, which is often about engagement and understanding of the system and what the needs are, setting up some structures, setting up priorities. Moves into phase 2, where you're building capacity within the system to do the implementation of the innovation that you've chosen, and so on. Often people think implementation starts with training. It doesn't. That's a implementation strategy. It starts right back in the thinking about what needs to be done, what system does it need to be implemented in, and how can we meet the need best with the evidence that we have. The thing about implementation frameworks is they do a couple of things. One is they're very good to think about or choose when you're doing an implementation study. So any kind of research when you're looking at the extent to which things have been implemented and how it affects outcomes, because it gives you a sort of a broad kind of model to use. The second thing, though, that they can be good for is when you're applying implementation science and practice. That is, you're working alongside government, services, all sorts of different groups to take a evidence-informed practice or program from idea to implementation. They're terrific to help guide that process. And it doesn't need to be a tick box or a check box. You sort of horses for courses at Centre for Evidence Implementation. We have 3 or 4 that we like to use for different implementation efforts. Some have actually been studied And that is some nice controlled trials have been done where they study whether an implementation framework was used or not, and whether something was more effectively implemented. And it has shown when an implementation framework was applied, things were implemented more effectively and sustainably than when business as usual was done. So they've made a very big contribution to especially the first 10 years of implementation research. The second thing that made a big splash is what essentially are called conceptual frameworks, which is a bit confusing because the word framework comes up, but it's where researchers studied all the things that could possibly get in the way, that is barriers, and or facilitate implementation of an evidence-informed program or practice. And one of the most famous ones is up on the slide here, and it's called the Consolidated Implementation Research Framework, or CIFR for short. Laura Damschroeder, who was the developer of this some time ago, the publications now where people are using CIFR to either study the process of implementation and or help identify barriers and facilitators and therefore develop an implementation plan have equally exploded. So there's a terrific 2017 paper that did a systematic review of all the different papers that have used the CIFR to either do one of those two things. But what the CIFR helped us understand was there are a number of domains that will affect whether or not an evidence-informed practice or program is implemented effectively. One of them is characteristics of the intervention itself, and that looks like there's a spelling mistake, and I apologize. For example, the strength of the evidence behind the intervention, relative advantages there. What that means is people's perception that the new innovation or intervention is better than the thing that they were doing before. It's often quite has a relationship between whether or not they'll implement the new innovation, and if relative advantage is seen as low, it's something that you can fix. Adaptability of the intervention, how complex it is or not. Obviously, something that's not as complex is a little easier to implement. So these are things that CIFR has shown are important elements as to whether something will are barriers or facilitators. Inner setting often means the organization in which the innovation will be implemented. Outer setting means all of the things external to organizations that will affect it. Individuals are involved in the implementation, self-efficacy being the idea of people's perception of how much control they have over what's about to happen, where they're at with their own stage of change, and then the implementation process itself, how well that's done, how well the phases are implemented, how effective are the implementation strategies. All of these things kind of merge together to help understand whether, again, we can break some of these barriers down and build up these facilitators to really reap the benefits of a lot of these evidence-based approaches. The other thing that implementation science has contributed to over the last decade or so is innovations in evaluation designs. And these are loosely referred to as hybrid evaluation trials. In that, sometimes it's difficult. One of the criticisms of sort of straightforward randomized controlled trials is that at times they don't monitor or track the extent to which the innovation has been implemented. And at other times, it's just unrealistic with the rollout of the innovation that a controlled trial can be developed. So very, very smart implementation scientists, Jeff Curran, who's referenced here, have been thinking about over the last 10 years or so, what kind of other evaluation innovations can be put in place where we can answer, not only assess the quality and effectiveness of the implementation, but at the same time, the effectiveness of the intervention itself. And these are loosely known as hybrid designs. You can see there's a reference to type 1, 2, and 3 there. They all have their limitations, but their strengths. And it's helpful if you're thinking about different ways to do evaluation in real world settings to have a little bit of a deep dive into hybrid designs. Some examples here are one called a stepped wedge, which is represented with the very kind of awkward looking box down the right hand side with the blue colored in boxes, where you're essentially controlling the rollout of an intervention across sites, so that you can see it's very similar to what some of us know as single subject designs or non-concurrent multiple baseline designs, where you're staggering the rollout of an innovation to watch if there's any change across sites over time. There's also these other very, I think both of these were developed in the US, and I hope I'm not going to offend anybody on this call, but there's a love for acronyms there. So most multi-phase optimization strategy, which is the diagram directly above on the left-hand side, and also SMART, sequential multiple assignment randomized trial, which is much easier to say SMART than the other one. In particular, I think one of the benefits of the MOST strategy is you'll see, if you can squint your eyes and see that tiny diagram, that strategy allows for some preparation and some improvement of the intervention itself. One of the hot topics in implementation science is this issue between keeping fidelity to the implementation of an innovation versus adaptation for local context. And how do you balance those? There's quite a few debates that go on. Personally, I think adaptation is needed in most instances, particularly if the innovation was trialed in a country outside in which the innovation will now be trialed in. So we do a lot of work, obviously in Australia and Singapore. A lot of the interventions that systematic reviews would guide us to use have mainly been developed in the US. And I'd argue some of our context in both those countries is quite different. And so some adaptation is required to enable them to better fit with the setting. And the MOST approach kind of helps you do that. So I'd encourage people to look that up if that's unfamiliar to you. Another piece that of work that the implementation science field contributed to was thinking about how we measure. So if we are going to put a lot of effort into innovations and evaluation designs, like the various hybrid designs I've given an example of, it's also important to think about measurement. And for a long time, if you this is Enola Proctor developed this conceptual model. It's a terrific piece. It influences a lot of the work we do, where she really laid out, we need to be really clear about what our what is, if you start on the left-hand side, what our effective service or intervention is, but also be very, very clear about what our how is, our implementation strategies that we'll be applying. But then in the past, we may have directly just jumped to measuring outcomes, whether it be, this is a health example here, whether it be service outcomes or patient outcomes. And Enola really effectively argued and has influenced a number of us that we also need to measure what she talks about as implementation outcomes, because they affect the extent to which our service or patient outcomes are met. And there's an example there with the circle where she talks a lot about feasibility. It's pretty straightforward. Fidelity, which is the extent to which the original model was followed. But other things like acceptability, which people sometimes think is soft measurement, often referred to as process measurement. But if somebody doesn't find something acceptable, it's unlikely going to be implemented well, and therefore highly unlikely to achieve the outcomes that it needs to achieve. Uptake, costs. So the contribution she made coming in behind the innovation evaluation was about this thinking broader about the way we do measurement and how we do measurement in implementation studies. And as a result, there has been this proliferation, if I can say that properly, of tools trying to fill some of the gaps, if you like, in these implementation outcomes and how we track the implementation process and strategies. And this is just a small example from the book. You can see there's a great evidence-based practice attitude scale that Greg Ahrens set up a long time ago that has been adapted to multiple countries. It is somewhat predictive as to whether this was particular to a mental health context, but did predict whether or not something was going to be acceptable and implementable. There's a nice leadership scale that Greg's also done, looking for the presence of certain characteristics that are conducive to implementation. I don't know why, but a lot of leaders do not like taking that scale. There's scales now around climate, around readiness, and so on and so on. If anybody's interested in this, the Society for Implementation Research Collaborative, that is associated with the University of Washington in the US, put a lot of work into trying to document all implementation measures that have been developed over time and the extent to which how valid and reliable they are. And if you join, and it's a very small fee, you can access that that resource yourselves. But that's just a little flavor. And that is really, I mean, if you look at the Implementation Science Journal and just the sort of things that they publish, it's a lot of tool development at the moment. The other major contribution that implementation, well, the other major part of work that implementation scientists have been doing is identifying implementation strategies and trying to define them, study them, and there's been some really impressive contributions by some folks. This table comes from an original paper by Jeremy Grimshaw, but came from a paper done by a colleague of ours, Byron Powell, and a bunch of other terrific people. Well, they sort of did a call out. The next wave, a hot topic in implementation science, is about studying what are the right implementation strategies for the right context, matched to the right evidence-informed program of practice. And this little table here just shows they did a review of implementation strategies in healthcare to see what worked. And I'm just going to draw your eye down to audit and feedback down there. Enormous amount of randomized controlled trials in healthcare settings showing that a basic implementation strategy like audit and feedback, which is literally auditing was the clinical guidelines or program implemented as planned, and if not, providing feedback via data, is quite effective as a strategy itself to achieve better implementation of the program or practice. As were other things, computerized reminders, tailored implementation strategies. What Byron did for his PhD was, we're all grateful for. He went and identified all the implementation strategies that have ever been identified in the published literature, got consistency on names, got consistencies on definition, and then published on it. Because it's one of the problems with implementation science has been the terminology has been a bit loose. So if you're trying to look at the overall weight of evidence for particular things, it can be difficult because things are called different names. So he did a little bit of this work, and then folks have started to do systematic reviews looking at the effectiveness of the strategies themselves. And I'd say there's a lot more work to do. Byron identified more than 80 implementation strategies in the published literature itself. And one of the topics people are quite interested in that colleagues of ours term is how low can you go? What's the least amount of implementation strategy you can put in place to get the effect? The Byron's article, and I'd encourage anybody to go and get this, it's open source on I think Frontiers published it. He sort of called for a research agenda to kind of really push our understanding of how implementation strategies can make a big difference to improving healthcare, and that is bridging this gap between what works and what's implemented. And he laid out 5 major areas of work for the coming decade, so what we're now calling the 3rd decade of science. And these are, you can see, enhancing methods to design and tailor implementation strategies. And him and his partners use a lot of techniques called intervention mapping, a lot of really sophisticated techniques to try and identify strategies, specify mechanisms. There's quite a bit of work going on where people are trying to understand what seems to affect what in implementation, understand and do more effectiveness research on what actually works from an implementation strategy point of view, understand what it costs. And this number 5, we're doing a project for the Wellcome Trust at the moment, evaluating, doing a systematic review on the effectiveness of problem solving as an active ingredient for decreasing depression and anxiety in young people. And it is so tough looking at this literature because very few people report properly on not only what is the intervention, whether it was implemented properly and what implementation strategies were used. So I think 5 is of particular importance so we can understand the science we have now. The other area that has equally blown up now that we're moving into the 3rd decade of research is if there's this science around implementation and how to break down barriers, build up facilitators, what implementation strategies we need, what's the right framework, it sort of begs the question is, it seems like there's a workforce emerging of implementation scientists or specialists who are using this science in practice. And colleagues of ours have recently published a paper trying to understand what are the skills and competencies implementation support practitioners need to be able to apply the science in practice as an emerging discipline and an important part of the system in terms of bridging this gap. They can also be referred to sometimes as knowledge brokers. I think both the UK and Canada talk about that to a certain extent. So this is a space to watch where the first author in particular, Bianca, argues quite compellingly that we need to test what would be the sort of competency skills that people need and then train and support the implementation of that just as carefully as we would evidence-based innovations. I feel like I'm hitting you with all the big things. I think I'm down to the last 2, but I can't see them ahead of my slides. But going into the 3rd decade of implementation science, another big piece of discussion and publication and thinking is this concept of scaling, scaling up, scaling out, some people talk, and sustainability. And implementation science for sure recognize that the areas are dependent on each other. And the one reason I put this slide up, so this is developed by some colleagues of ours in the US, is this really nicely shows that the argument the authors are making that to achieve scale, that is, go from implementing to a number to reaching a good proportion of the population who could benefit from the innovation, we need to be thinking about not just what in this case, the intervention is, but how that fits with whatever practice setting it's going into, the staffing that has, the organizational culture and climate of that setting, business models, training, supervision, but also, and this is the bit that sometimes really isn't attended to, the ecological system. So some of the work we do where we're trying to work with a number of community service agencies to bridge the evidence to practice gap. At times, training's put in place and some coaching is put in place maybe, but little changes in the practice setting. And so it sort of undermines what the front line is learning or trying to do. And that has been shown in a number of studies in implementation science. But equally, sometimes little attention is paid to the ecological system. So the way the government is setting policies, how the funding has been sent out, what regulations are people needing to operate under. So I think this nicely shows that when we're trying to think about implementation and then implementing at scale, these 3 areas need to be thought about and also thought about in terms of how do they fit with each other and what can we do to enhance that fit. Now, one of the major gaps in implementation science is good quality research in low and middle income countries. This is a terrific review I'd encourage anyone to read, where they really did demonstrate that most of the implementation science research is based on research conducted in high income countries. and there'd been little application of some of these frameworks. The authors also argue that over time, some of the more complicated implementation frameworks just aren't realistic in lower middle income settings, A, because the resource isn't there to try and put them in place, and or B, there's a time issue. And so that is a really big gap and something that the implementation science community, I mean, there are some terrific pieces of work done by, again, colleagues of ours out of Johns Hopkins and various University of Washington and various places, but the amount of studies is far less than in high income settings for sure. And then hopefully none of you, I do know there's somebody on this call that's heard me say this before, but implementation is a team sport. It requires and is very dependent on the engagement of people and organizations. And often these people and organizations have different views on what the right thing to do is. And so there has been these attempts to figure out how to help that. There's not a single implementation framework that doesn't have some core activities that involve not only stakeholder engagement, but also forming implementation teams who are tasked with moving the innovation from idea to implementation. So the co-creation movement that has been somewhat controversial, sometimes it seems to work well, sometimes it doesn't. I think it's down to how well it's implemented for real. There's some nice research around change agents, but also some really interesting stuff around partnership models and the creation of implementation teams to help, in particular, community engagement. That is an emerging area of work, and I think sometimes overlooked because people take stakeholder engagement for granted, but without it, most implementation efforts fail. Sorry. So to sum, putting some implementation science in action and just thinking about what we've covered, we've talked a little bit about frameworks and how implementation occurs in phases and stages, no matter what, no matter how urgent the implementation effort means. There's often some assessment of need required. It often depends on readiness and so on. It talks about these rapid continuous monitoring and improvement attempts that need to be put in. These are all things that are sort of known now really in the literature as important to enabling implementation. But as you can see, I've highlighted from the last couple of slides that we have a big way to go in terms of implementation strategies, which ones for where, who, mechanisms, the use of stakeholders. So there's still a lot to do, but we know, given it's over 20 years of research, we've made quite a bit of progress. Small ad, switching tact. So we Center for Evidence Implementation and Monash University are hosting a summit March next year, and with all the COVID activity going on, we have moved to a hybrid model, which essentially means we're going to have a small group in Sydney. We probably will have a small group in Melbourne now, and then most of it will be online. The benefit of this is anyone will be able to participate from anywhere. We promise we will make sure that the online version is not boring. And there'll be some engagement with hopefully some smaller events in other cities associated with the event. So please, if you have some work you'd like to submit as an abstract, do that. If you want to get involved, there's the details there. But it's all about the use of evidence and implementation, very relevant to this talk and relevant to, I think, a lot of the work you would all do. And that is me. I think Zara's coming back.
Thank you, Robyn, for this extremely informative webinar. It was very much enjoyable and interesting as well. So we can start by taking questions.
Yes, Nikki, you can get a copy of the slides.
So as a reminder, you can either type in your question in the question tab, or you can press the raise your hand button and we can unmute you.
Maybe they need to look at the slides and, you know, read the book chapter and have a good think. Or come to me later. How long do you make them wait, Zara?
We can wait a couple, like 2 to 3 minutes.
This is where cameras are quite good, because then you can kind of look at each other and go, just ask anything. Should we let them off the hook?
Yeah. So I just want to thank you, Robyn, again for this great presentation. And as
Thank
for
you.
the attendees who are with us today, just make sure to follow us for other sessions for the Legacy webinar series. And if any of the attendees have any questions for Robyn, please send us your question and we can direct you to her, or you can contact them directly. Thank you so much. Oh, it seems we have a question.
Go, Mike. Mentor Mike.
Yes, there's a question from Mike Punkanas asking aspects of gender interventions working or not working for men, women, non-binary have been underrepresented in IS over the past decades. How can we move this discussion forward?
Well, with people like you, it sounds like, Mike, I mean, that's a terrific question, and you are 100% right. That is a huge gap over the last couple of decades. I mean, one way, this is a bit self-serving, but you could put up a discussion for the summit and participate in that. But that is, I haven't actually seen anyone, maybe one other person even ask that before. There is some nice work coming out of one of the foundations in the US, which I'm going to fail to remember right now, around equality and equity, and the issue that implementation science isn't always behaving in a equal or equity kind of manner. So that might be a place also to forward that. We've done a little bit of writing around that. Gosh, what is the name of the foundation? If I think of it, I'll send it to Zara. There was a very good presentation at a conference where they really called out the lack of that. So terrific question. And I wish I had more to say about that.
Thank you. We have a comment from Nikki saying, thanks, Robyn. I do have questions, but trying to formulate them.
I love that.
We have another comment from Elena Nasasku saying, thank you for the presentation. I enjoyed it a lot.
Thank you.
Another
Carrie.
comment
from Carrie.
Great talk, Robyn. Just wondering if you have any thoughts on how we go about encouraging more systematic documentation of cost data when sharing findings, including informal publication. This is not a cultural norm.
No, it is not. And you know, we recently, Carrie, wrote we provided some feedback at a document that was provided here around the cost of doing evidence-based approaches and how it's better if you do that from a prevention point of view. You know, the whole idea you'll save money later, but they didn't articulate at all the cost of implementation. And some of the models they had put up are really, really expensive to implement. Not to say you shouldn't do them because they're expensive, but they hadn't at all shared or thought about that. Again, I think it's a good one to put up for some of the implementation science, you know, communities that are popping up. I know Byron Powell, you know, he has named it as one of the key areas to forward around research data. So I just think contributing to the conversation about it would help. But I'm 100% with you. It'd be good to see. And thank you, Carrie.
Thank you. Another comment from Sam Borrow saying, thanks, Robyn. I'm new to this, so no questions from me, but very informative.
Yay for you, Sam.
And Gitu Sign says, great presentation.
Thank you. Yours also nice. All right, well, just join the summit. If you like this, there's like hours and hours of fun with more people than me to hear from or meet. Thank you very much, everybody, and have a really awesome day.
Thank you, Robyn, so much for this presentation.
Thank you.